Depression affects millions of Americans year-round, but specifically during these winter months, when a severe form of depression has been known to impact the lives of at least 11 million of us. Now, there is help with a new form of genetic testing, though, called GeneSight. It can really help us out, and here to tell us much more is Dr. Sagar Parikh of the University of Michigan Comprehensive Depression Center. Doctor, welcome aboard. Thanks for joining us.
Well, thank you.
It's great to have you here. Look, University of Michigan, it's a land of hard winters. Winter depression, what is it about this time of year, and what are the symptoms?
Well, 19 million Americans experience depression every year. A lot of it flares up in the winter, and, there's less sunlight, we get out less, we exercise less, and all of those contribute to this. And, it can create a lot of symptoms, low mood, low energy, problems with thinking, pessimism, and so on.
Look, I mean, you've got the cold, you've got shorter daylight, a lot of gray skies in much of the country, things working against us. So if we start to have a depression situation, what are some of these treatment options that are now developing? Talk about that.
Right. So, depression needs multimodal treatment. So obviously, if it's dark, you need light, you need friends, you need social activities. But for most people, depression is really impairing them, and often you need medications. And one of the problems with antidepressant medication is the first pill that you pick usually works less than half the time. So where personalized medicine has gotten us today is some genetic testing, which can help us choose medicines more effectively.
GeneSight is what it's termed. Give us a little more detail, and can it also help determine if, look, we're just in a little bit of a funk, we're not really in a state of depression? Can it help with that as well? Tell us more about GeneSight, sir.
Right. So the first thing is that genetic testing does not give us a diagnosis. We're not there yet. I think at some point we will have blood tests that can tell us more about whether we're in a real chemical depression or just having a bad day. So that's a clinical decision. But there are a number of genetic tests. GeneSight is the most widely used. It looks at 12 different genes and tells us two big things. One, how does this person's serotonin work, the brain chemical that is implicated in depression? And secondly, how does that person's liver work in terms of breaking down or metabolizing medication? You put the two pieces of information together and you compare it to existing medicines, and all of a sudden you can generate a list of medicines according to green, yellow, or red, where green means there's a good chance that this person can tolerate this medicine, and there's a greater chance that this medicine will work.
Well, and that's always the goal. If we have to go to that antidepressant, we want it to be the most effective out of the gates, if possible. Doctor, do you have just briefly last question here, do you have a success story maybe you could tell us, how you've used GeneSight perhaps in your own work?
Sure. The usual kind of patient who needs this is someone who's tried antidepressants before and went through a lot of trials, and it took a long time for them to find success. So I often have patients like that who've had depression in the past, had treatment in the past. They're not in treatment now. They get a new depression, and they say, don't put me through the mill trying 10 different medicines. So lately, we've been trying this test. We've been getting a list of results from this test that suggest which medicines are more likely to work. I've tried it, and quite often I've found that it's helpful in finding the medicine that'll work first. And so in that sense, it's really shortened the time to getting on to the right treatment.
Outstanding. Well, we know it is called GeneSight, something helping our medical practitioners so much now with depression across the country. Doctor, thank you so much for joining us this morning.
Thank you for having me.
Great to have you here. Well, stay with us. When we come back, if you have a little bit of the winter blues yourself, we've got great news, how you can enter to win a Caribbean getaway. Stay tuned.